Hi, hello, my name's Harmi and I'm from West London English School. In this video today, we're just going to look at the OET Speaking subtest and how to open a role play. Now, it's not as straightforward as you might think. It is a bit tricky, and we're just going to look at a couple of ways which you could open the role play, and hopefully you'll find this video useful. So first of all, just to quickly recap what the speaking exam is, it's a consultation. You start off with warm-up questions. These are going to last a couple of minutes, and it's really just for you to get to know the examiner and to relax you. And it's nothing too heavy, it's just questions about yourself. Once you've done the warm-up questions, you're given a role play card like this, which we'll take a look at in a second. You have 3 minutes to prepare your role play, and then you have 5 minutes to do the role play. You give back your card, you're given a second card, and you do the whole thing again. So the whole thing will last about 20 minutes. So this is an example of a role play card. You can see here it tells you who you are. Remember, speaking is specific to your profession. So everyone, whether you're a doctor, you'll have your own tasks. Nurses have their own, pharmacists, vets. It's different from reading and listening. Remember, speaking and writing are specific to your profession. So at the top you have setting. This is really important. We're going to look at this a bit later. You're given background information and some context. And again, this is really important. And at the bottom you can see you have tasks to do. Okay, so you've got 3 minutes to prepare for your role play. This is from the criteria, the clinical communication criteria. And you can see under relationship building, I'm just going to highlight this thing here. It says initiating the interaction appropriately, greeting, introductions, and nature of interview. So essentially, you're awarded marks for opening the role play in an appropriate way. Remember, you're the medical professional, whether you're a nurse, a doctor, a vet, an optometrist, a dentist, a pharmacist, and you're the one who will open the role play. The interlocutor or the patient will be waiting for you to start the role play. So this is a great opportunity to pick up some extra marks. Let's just have a look at this is a little bit more just like medical English. And these are different stages of opening a consultation. So we've got a quick task here. What is the nurse or doctor doing? Good afternoon, Mrs. Jones, isn't it? Hello, can I check it's Mr. Cartwright? We've not met before. Joseph Garcia, hello. What would you prefer me to call you? Hello, Mrs. Petrovsky. Am I pronouncing it correctly? Okay, guys, just take a few seconds. Think, what is the person, the doctor or nurse, doing here? Okay, so I'm sure you can see what the doctor is actually doing, or the nurse. They're obtaining the patient's name. So that's the first thing. They're actually getting the patient's name. Okay, let's look at the second task then. Again, what is the nurse or doctor doing? I'm a nurse working with Dr. Smithson. My name is Dr. Yanovich. I'm one of the registrars on the ward this evening. I'm Mr. Barker. My colleague, Dr. Adams, has asked me to come and see you about. Dr. Wilkinson has referred you to me for further investigations. My name is Dr. Edwards, and I'm Dr. Cruyff, the locum with this practice. Okay, guys, again, just take a few seconds to have a read and think, what is the nurse or the doctor doing? And I'm sure you can see this time they're introducing themselves. So they're giving their name, essentially. Okay, we've got one more stage to look at. Again, what is the doctor or the nurse doing? I've come to have a little chat with you about. I'd like to spend 5 minutes with you to ask you some questions, if that's okay. I wonder if we can chat for a few minutes about. Okay. 10 seconds, just think, what is the nurse or the doctor doing? Okay, that's a little bit more tricky, but you can see we're setting the agenda, or basically we're telling the patient in advance what we're going to do. It's kind of like the purpose of the consultation. And we can also call this signposting as well, which can get you some marks in the OET exam. Signposting is where you tell the patient in advance what you're going to do or what's coming next. Okay, so just to recap those 3 stages, we had obtaining the patient's name and finding out how they'd like to be addressed, introducing yourself, and finally setting the agenda, the purpose of the consultation. Okay, so we're just going to read a short dialogue, and in this dialogue you need to identify if the doctor or the nurse has met the 3 stages. Okay, so this is the short dialogue. The doctor says, "Good evening, Mr. Dickens, isn't it?" The patient says, "Yes, that's right." The doctor says, "Okay, now Mr. Dickens, sorry, what would you prefer me to call you?" Tom. Tom's fine. "Tom, I'm Dr. Smith and the registrar on the ward this afternoon. Your consultant just asked me to drop by to see you, to see if there was any pain after the operation. Are you comfortable?" "Yes, I'm fine, thanks." "Good. So I'm just going to ask you a few questions if you don't mind." Okay, so if you think about the 3 objectives we've just looked at, did the doctor meet those 3 objectives? Well, the first one we know was obtaining the patient's name, and that's exactly what this doctor did. They got the patient's name and they also found out how they would like to be addressed. And in this instance, you can see the patient was perfectly happy being addressed using their first name. The second stage was giving your name to the patient, basically introducing yourself, and that's exactly what the doctor did. And if you remember, the final stage was setting the agenda or giving the reason for the consultation, and that's exactly what the doctor did. So we've got 3 stages there of opening a role play, but it's never that easy with OET because you're given different scenarios. So there are different possibilities of how you can open the role play. I talked earlier before about settings, and the setting is really important. Try to take note of the setting. Because it does influence how you open the role plays. And there are lots of different settings. These are just some. It could be a home visit. If you think about a home visit, the chances are that you know the reason for the consultation or for the visit. And you'll have the patient's name and the patient's details, and they will be expecting you as well. So it wouldn't really make sense if you started off with a formal introduction. And again, try and think of this as a real situation. You wouldn't go to a patient's house and knock on the door and say, "Hi, could I have your name, please? How can I help you?" It really doesn't make sense. So you can see with a home visit, you may know that you'll definitely know the patient's name and you'll know the reason for the consultation. So something a little bit more informal would be appropriate here. Another setting, a common setting, is a surgery clinic. You might be a GP or you might be working in a GP's clinic. And with the OET, they like you to think that if you are a GP, you probably will know your patient. So it really depends on the context they give you. You may know the patient, you might not know the reason for the consultation, but you might know as well. It all depends on the information they give you on your card. Okay. Another setting, there's A&E, accident and emergency. In this kind of setting, again, it depends on the context they give you. You may not know the patient, you may know what's wrong with them, so you might need a bit more of a formal introduction. But it really does depend on the context and the information which they give you. Okay, guys, what we're going to do, we're just going to look at a short opening exchange. We're going to look at 3 different possibilities. What you've got to decide is which is the best way to open the role play. So, first of all, this is some context. You can see you're in A&E. it's accident and emergency. The context they give you, it says this patient is presenting with a minor cut on the sole of his or her foot. Having examined the cut, you decide that it needs to be cleaned and bandaged. Okay, and we've got 3 different exchanges for you to read. You need to decide which is the best way to open the role play. And guys, you've got 30 seconds to do this. Okay, I mean, all of these are fairly nice ways to open a role play, but in this task, there's only one which is really suitable, I think. First of all, it tells you at the top the context. It says, actually, it tells you that you've examined the cut. It says, having examined the cut, you decide that it needs to be cleaned and bandaged. So in other words, you're not at the beginning of the consultation. You've already examined the patient. In this role play, it's assumed that you've already introduced yourself, you've done the introductions, and you've moved on to examining the patient. Because you're not at the beginning of the role play, the consultation, but you're actually in the middle, I think option C would probably be the best way to open the role play. And you can see here it says, okay, John, so I've just examined your foot. So in a way, they're assuming that you've already done the introductions. It wouldn't really make sense if you start examining the patient and then after a few minutes you would say, what's your name, please? And you introduce yourself. So really take care when you do these tasks. This was A&E, it was accident and emergency, but you were in the middle of a consultation. Okay, guys, we're going to do another task now. What we're going to do, we're going to look at a couple of role plays and we're going to look at some ways we can start these role plays. So you're going to see a task, you can read the task and you've got a few seconds to think about how you would open the role play. This is task 1. Okay, I'm going to let you read this. You've got 30 seconds. Okay, so what do you think? Do you need a formal introduction, or can you be a little bit more casual? Do you know the patient? Do you know the situation? These are all things you've got to work out in those 3 minutes. In this task, well, let's look at a sample answer. First of all, the setting, you're in a general practice, so you can assume that possibly you do know this patient. And actually there's a big clue in the first line. In the context, it tells you your patient. So this means you do actually know the patient. This is your patient. So you know the patient, and the chances are you probably know what's wrong with the patient because it was a recent diagnosis. It may even be the case that you were the one who made the diagnosis. But this is a recent diagnosis that was made. The patient is coming back to you, and you're going to see how they're getting on. So in this kind of situation, again, a formal introduction wouldn't really work. You know the patient, you know the situation. So something a little bit more casual and informal would really work. For example, something like this, where you can say, "Hi Mary, how have you been getting on?" And the patient might say something like, "Okay, thanks. It has been difficult to stop playing basketball, but I've got used to it and I'm feeling better than I was." That's good to hear. How's the medication working out? So you can see we've gone straight into the role play, and actually we've started off here with quite informal, casual language. And this is really important, in fact, because you get marks for building up a relationship with the patient. So you don't want to be too formal. You want to be approachable. If the patient has any questions, they should feel comfortable with you to ask you these questions. So you need to get the balance right between being formal yet polite. So don't be overly formal. And you can see here, how have you been getting on? It's quite a casual way to kind of just ask someone how they are. Also, you'll notice it's an open question as well. And it's a good way to start the role play. It's just a nice kind of introduction. Think about your intonation as well. Remember, it's a speaking exam. Keep the intonation, kind of make sure you're confident, but use the tone of your voice as well. Keep it warm and welcoming, I'd say. And also at the bottom as well, that's good to hear. How's the medication working out? Okay, again, it's another open question, so we've gone now straight into the task as well. Okay, so that's one possibility. Let's have a look at another role play now. We'll have another task to look at. Again, think about those things. Think about the setting where you are. Think about your relationship with the patient. Do you know them? Don't you know them? Are you aware of the situation? Also think about whether it's really critical, whether it's a sensitive issue, because if it is, you might need to use some indirect language. So there's a lot to think about. You'll see a card now, and then you're going to have 30 seconds to read and think about how you would open this role play. Let's have a look. Okay, so you can see in this task, this time it's a home visit. And as we said before, with a home visit, the chances are you're probably at least going to know the patient's name and you're going to know the reason for the consultation. So let's have a look and see the sample answer here. Like we said, it's a home visit. And it's giving you really the purpose of the consultation. A GP has asked you to visit the patient about their diabetes. Here's a possible way of starting the role play. Hi, hello, I'm Harmi, a nurse from the clinic. Is it John Smith? Yes, that's right. Is it okay if I call you John, or would you prefer to be called Mr. Smith? John's fine. Okay, John, your GP's just asked me to come and have a chat with you about your medication. How do you feel about using insulin injections? Okay, so you can see here the first thing the nurse has done is basically introduce himself. As it's a home visit, it does make sense that you would give your name first and say who you are rather than asking for the patient's name. So that's what the nurse did. And then they got the patient's name. You can see, is it John Smith? Would you prefer to be called Mr. Smith? Is it okay if I call you John? So we found out how to address the patient as well. And often with OET, first names are generally okay and acceptable. Finally, as well, setting the agenda, then of course the patient is expecting you, they know why you're coming to see them, but it's just nice to use this we call signposting and telling the patient the reason for the consultation. Okay, so just on a side point, another tip here, this isn't directly related to opening a role play, but we're talking about using those 3 minutes, and something else you can do in those 3 minutes is you can use the verbs to really help you organize your task, because you're given those 3 minutes for a reason and you want to put those 3 minutes to good use. As well as trying to work out how you're going to open the role play, you can kind of think about how long you're going to spend on each task. And remember, you can write on your card, you can make notes, you can underline things as well. So I've put here, use the verbs to help you. And you might remember on a card, the tasks all start with verbs, and these are the things that you're going to be doing during the 5-minute consultation. You're going to be finding out, reassuring, explaining, and you're going to stress something. You'll be emphasizing something. And if you think about, well, how long will you spend on each task? And there's a lot to think about here. The first verb said find out. Well, need to think, how many things do I need to find out? Will I be able to use open, or should I use closed questions? My language, is it going to be indirect? Is it a sensitive issue? Do I need to use indirect language, or can I be more direct? So the second task was reassure. You're going to need language of empathy or sympathy. And you think, how am I going to reassure the patient? What kind of things am I going to say? Make sure if you're explaining something, you're going to do it in a simple way. Don't use medical terms, and also be sensitive as well. Certain things you can say, please don't worry, you're in good hands. So you've got to think, how am I going to reassure the patient? If you explain as well, that was the third task. It said explain. So the first task said find out, and think, how many things do you actually need to find out? Is it just one question, or do I need to find out 3 or 4 things? And remember, you need to break up those questions. And if you're finding out, you remember you might have to clarify, if they're giving you important information, like some kind of symptoms or how they got the injury, then if it's important, you might need to paraphrase. So there's a lot to think about there. Using open or closed questions. Your language, if it's a sensitive issue, you might need to use indirect language. Reassure, think about how you're going to reassure. You're going to have to be empathetic and really put yourself in the patient's situation. I know that's something that helps me a lot during the role play. And you're going to be sympathetic as well. Explaining is a good way of reassuring the patient, of course. Make sure you explain things in a simple and sensitive way. There's lots of things you can say as well. There's, please don't worry, you're in good hands, etc. So there's lots of different ways of reassuring a patient. You need to think, how am I going to reassure them? The third task was explain. Remember, avoid medical words. Keep the language simple, use layman's terms. So just use everyday English. Don't fall into the trap of using too many, or in fact using any kind of technical medical words. Remember, using sequences can help you, can get you a few extra marks sometimes. Signposting is always useful. And the last verb was stress. You're going to have to emphasize something. And again, you think, how am I going to emphasize? There are certain things you can say, it's really important that you do this. I'd really recommend, or I'd recommend you don't do this. So there's a lot to think about with those 4 tasks you have. If we go back, something you might want to do is think about, how long will I spend on each task? Well, the first task, find out, depends actually what the patient says. You've got to listen to the patient. Listening is a massive part of the speaking exam, because if they ask you a question, you must respond to your patient. So find out, it depends really what the patient says, but probably we're not going to spend too long on this. You can see with reassure and explain, these tasks are probably going to take more time. And like I said, it does depend on what the patient says as well. And it is so important you listen to your patient during the consultation. Okay, guys, so just to recap, remember during these 3 minutes, think about how you're going to open the role play. You need to open the role play appropriately because you're in control of the consultation. They're going to be waiting for you to start this consultation, and it's a great opportunity to pick up some extra marks. Think about your relationship with the patient. Do you know the patient, or perhaps you don't know the patient? Take note of the setting and the context. This can really help you. And think, do you really need a formal introduction? It goes back to really knowing the context, the situation. Are you at the beginning of the consultation? We saw earlier with one of the tasks, you were in the middle of the consultation and that influenced how you open the role play. Remember, it is a speaking exam, so speak clearly, speak confidently, keep the intonation fairly gentle as well. Okay guys, I hope you found that video useful. If you did find that video useful, please like and please do subscribe to our other videos. If you're taking your exams soon, we wish you all the best. Check out our other videos or check out our courses at wles.net. Take care guys, it's been a pleasure working with you and all the best.